को छुपाना आई है ईद लेके खुशियों का नजराना मुनासिब नहीं है तुम्हें भूल जाना याद है वो लम्हे खाई थी कसमें ईद मुबारक तुम्हें ईद मुबारक।
Hello everyone. तो आज क्विज स्टार्ट करते हैं।
तेरा दिल है मेरा ठिकाना मुझे सिर्फ है तुझे अपना बनाना आई है ईद लेके खुशियों का नजराना मुनासिब नहीं है तुम्हें भूल जाना याद है वो लम्हे खाई थी कसमें ईद मुबारक तुम्हें ईद मुबारक तुम्हें ईद मुबारक तुम्हें ईद मुबारक।
हेलो एवरीवन। तो क्विज स्टार्ट करते हैं। Psychological counseling of a patient that relieves suffering brought up by psychological exciting factor was designated by Handman in Moral Remedy. Myocardial injury in acute myocardial infarction as a result of sudden occlusion of the coronary artery is an example of coagulative necrosis. Myocardial injury in acute myocardial infarction as a result of sudden occlusion of the coronary artery Myocardial injury in acute myocardial infarction as a result of sudden occlusion of the coronary artery is an example of coagulative necrosis. The diagnosis of endometriosis is suspected on the basis of typical history. Skin itching when undressing, uncovering, or exposure to cold air is a symptom of Rumex crispus, Rumex crispus, Rumex crispus, Rumex crispus, Rumex crispus. After lying down in the evening, he lies awake till late at night and cannot go to sleep. Is a symptom of asphyxia. Placenta secrete all the hormones except prolactin. Placenta secrete HCG hormone, human placenta lactogen, estrogen hormone. Except prolactin is not. Exclamation mark here are pathognomonic sign of alopecia areata. Exclamation mark here are the pathognomonic sign of in remedy reaction where the aggravation is quick, short and strong with rapid improvement of patient in fair is all except changes are comparable to change in deeper organ is wrong. Tropical pulmonary eosinophilia is caused by Wucheria bancrofti. Tropical pulmonary eosinophilia is caused by Wucheria bancrofti. Stool are Stools are knotty like sheep dung crumble at the verge of anus is a symptom of magnesia muriatica. Stool are knotty like sheep dung crumbling at the verge of anus is a symptom of magnesia muriatica. The peculiarity of homeopathic treatment of primary stage of psora is that it demands a specific remedy in large dose. The peculiarity of homeopathic treatment of primary stage of psora is that it demands a specific remedy in large dose. Who introduced the decimal scale of potency? Dr. C. Herring. Who introduced the decimal scale of potency? Dr. C. Herrings. Which medicine shows retention of urine with albuminuria? Which which medicine shows retention of urine with albuminuria? Terebinth. Which medicine shows retention of urine with albuminuria? Terebinth. Loss of smell and taste is a symptom of loss of smell and taste is a symptom of Alzheimer's. Loss of smell and taste is a symptom of Alzheimer's. Loss of smell and taste is a symptom of Alzheimer's. Respiratory acidosis result for retention of carbon dioxide. Respiratory acidosis results from retention of carbon dioxide. H.A. Roberts' concept of deflected current signifies H.A. Roberts' concept of deflected current signifies obstacle to cure. Obstacle to cure. H.A. Roberts' concept of deflected current signifies obstacle to cure. In uterine prolapse, decubitus ulcer is caused by venous congestion. In uterine prolapse, decubitus ulcer is caused by venous congestion. Involuntary evacuation of feces in sleep is a symptom of arnica montana. Involuntary evacuation of feces in sleep is a symptom of arnica montana. Madness during pregnancy is found in one of the following medicine: stramonium. Madness during pregnancy is found in one of the following medicine is stramonium. Which of the following article of Hahnemann is considered as precursor of organon, the medicine of experience? Which of the following article of Hahnemann is considered as precursor of organon, the medicine of experience? Lowest maneuver in breech presentation is meant to facilitate delivery of arms and shoulders. Lowest maneuver in breech presentation is meant to facilitate delivery of arms and shoulders. Fetal sleep is associated with what change in fetal heart rate? Decreased. Fetal sleep is associated with what change in fetal heart rate? Decreased. The principal site of inflammation rubor occur as a result of vasodilation of arterioles. The principal site of inflammation rubors occur as a result of vasodilation of arterioles. The stage in the life cycle of Plasmodia responsible for an infection and can be identified with distinct appearance in thick smear of peripheral blood is trophozoite. Backache relieved by lying on back is the characteristic symptom of ruta gravinolos. Backache relieved by lying on back is a characteristic symptom of Ruta. CSF CSF is CSF is finally observed in arachnoidal villi. CSF is finally observed in arachnoid villi. Common psychosomatic respiratory disorder is bronchial asthma. Common psychosomatic respiratory disorder is bronchial asthma. Number of years of healthy life lost due to ill health, disability, or early death is defined as daily disability adjust life year. Daily disability adjust life year. Number of years of healthy life lost due to ill health, disability, or early death is defined as daily. The nerve, the nerve that rests against the head and neck of the fibula and can be compressed against the body structure is common peroneal nerve. Common peroneal nerve. According to Stuttgart Clause, the second best remedy is sacrum lactic officinalis. Which of the following does not physiological increase in pregnancy? Blood pressure. The most common position of vertex at the time of engagement is the most common position of vertex at the time of engagement is left occipito-transverse. Hematocrit of 45% means that in the sample of blood analyzed is 45% of the blood volume is cell and the remainder is plasma. All the things that are predicted of any given organs are things in a particular. If you examine any part alone, you are only examining the particular. The statement was given by J.T. Kent. The border of the eyelids are painful on moving as if they were dry and rubbed upon the eyeballs is a symptom of arsenic album. In stomatitis, deep longitudinal cracks on tongue and excessive flow of saliva runs out of mouth when sleeping. Nitric acid. In stomatitis, deep longitudinal cracks on tongue and excessive flow of saliva run out of mouth when sleeping is syphilinum, not nitric acid, syphilinum. Urticaria all over the body without fever is one of the red line symptoms of Dulcamara. Urticaria all over the body without fever is one of the red line symptoms of Dulcamara. Retrograde menstruation is a feature of endometriosis. Retrograde menstruation is a feature of endometriosis. Endometriosis. Coldness with aversion being covered is an example of coldness with aversion to being covered is an example of negative gender symptom. Coldness with aversion to being covered is an example of negative gender symptom. Sjogren syndrome is a chronic disease characterized by which of the following clinical features? Keratoconjunctivitis, Zika. All the following are features of lower motor neuron disorder except sublower motor disorder except spasticity except spasticity. Fasciculation, flaccidity, and muscle wasting is a lower motor neuron disorder. Lower motor disorder. Latency is an outcome particularly characteristic feature of her herpes virus. Latency is outcome particularly characteristic of herpes virus. All of the following are feature of lepromatous leprosy except zero bacterial index. Widespread nodules and infiltration, loss of eyebrows, late nerve enlargement and damage. All of the following feature of lepromatous leprosy: widespread nodules and infiltration, loss of eyebrow, late nerve enlargement and damage. Complementary relationship is found in aconite, Naples, and sulfur. Complementary relationship is found in aconite, Naples, sulfur. Gastralgia relieved with eating with hepatic symptom. Chilodonium. Gastralgia relieved with eating with hepatic symptom is chilodonium. Hoarse voice, deep harsh sound like a trumpet, basso profound is present under verbescum. Analysis of a stool specimen reveals a small structure resembling rice grains. Microscopy shows these to be proglottitis. The most likely infestation organism is Taenia saginata. Inguinal ligament extends from anterior superior iliac spine or pubic tubercle. Anterior superior iliac spine to pubic tubercle. Hahnemann conceived idea of cinchona bark experiment during the translation of Cullen's treatise on materia medica. Hahnemann conceived idea of cinchona bark experiment during the translation of Cullen's treatise on materia medica. Hemophilia A is characterized by deficiency of factor 8. Hemophilia A is characterized by deficiency of factor 8. No flatus emitted upward or downward, especially after abdominal operation, is a feature of rapinus. No flatus emitted upward or downward, especially after abdominal operation, is a feature of rapinus. Nipple discharge associated with burning, itching, or nipple discomfort in older patients is suggestive of ductal ectasia. Ductal ectasia. Which of the following is the most common cause of hypothyroidism in iodine sufficient area? Autoimmune thyroiditis. For embalming chemical are injected in femoral artery. For embalming chemical are injected in femoral artery. Sudden fainting from least smell of cooking oil is an example of idiosyncrasy. Idiosyncrasy. Sudden fainting from least smell of cooking oil is an example of idiosyncrasy. All of the following are branch of arch of aorta except right common carotid artery. Except right common carotid artery. Which medicine have aversion for bread during pregnancy? Sepia. Which medicine have aversion for bread during pregnancy? Sepia. The fundamental law of palliation in homeopathic treatment of incurable disease condition is law of similars. Cones are prepared from mixture of cane sugar and egg albumins. Mixture of cane sugar and egg albumins. Gotron sign is found in patient of dermatomyositis. Gatron sign is found in patient of dermatomyositis. Dying declension can be recorded by anyone. Rheumatism alternate with gastric symptom, one appearing in the fall and another in the spring is one of the characteristic symptoms of Kali bile. Invasion carcinoma of cervix develop in which of the following region? Transformation zone. The second edition of Organ was published at Leipzig. The modified E-play maneuver is used for treatment of benign proximal position vertigo. Toothache in pregnancy is relieved by keeping cold water. Koffia. Wells palsy is a LMN type of facial palsy. Red infrared are seen in lungs. Red infrared are seen in lungs. First heart sound occur during the period of isobolomic contraction. Which of the following hernias follow the path of the spermatic cord within the cremasteric muscles? Indirect inguinal hernia. If the unconscious patient is unerasable by all external stimuli, it is caused by coma. Vertigo and quickly turning the head to left side especially is one of the characteristic symptoms of cholescenthesis. Which of the following is a major manifestation under Jones criteria for the diagnosis of rheumatic fever, erythema marginatum? When the dose of first medicine ceases to have a beneficial effect, a new examination must be ensued to know the status morbi. Which of the following statement is false for virus? Virus multiple by binary fission is a false statement. Virus contain either DNA or RNA. Correct. Virus require a specific receptor to infect cell. Correct. Virus contain a protein code. Correct. The neural plate forms directly from ectoderm. The neural plate forms directly from ectoderm. The only remedy for rubric basing in a mind section of BBCR is stramonium. Kolinchia is seen in iron deficiency anemia. Kolinchia is seen in iron deficiency anemia. Neuralgia of testicle with nausea, aggravation at night is a symptom of hemamelis. The quality of being preeminently trustworthy and conscientious of the homeopathic drug prover is explained in which edition of Organon of Medicine? Sixth edition. Serum ferritin is a maker of storage iron. The method used for preparing tincture from the mucilaginous and gummy substance from vegetable rhininum kingdom is macration. Which action of the medicine are commonly recorded during drug proving? Primary action. Sensation of something alive in abdomen and stomach is a symptom of Coccus sativus. Sensation of homeopathic. Sensation of something alive in abdomen and stomach is a symptom of Coccus sativus. Which of the following statement is false regarding Krukenberg tumors? They are primary ovarian carcinomas that are secondly metastasized to gastrointestinal organ. All of the following are effect of glucocorticoid except enhance the effect of insulin and inhibit gluconeogenesis. Stimulate amino acid uptake and protein synthesis. All of the following are glucocorticoids stimulate amino acid uptake and protein synthesis in the liver, inhibit amino acid uptake to the peripheral tissue. Which of the following is not feature of polycystic ovarian syndrome? Decrease LH ratio, FSH ratio. Which drug is known as dog mercury? Which of the following is not feature of polycystic ovarian syndrome is more than 12 peripheral arrange cyst to 9 mm in ovaries on sonography, right and ovulation सही hyperandrogenism decrease गलत increase. Which drug is known as dog mercury? Mercurialis perennis is known as dog mercury. Antidotes ill effect of eating shellfish is a symptom of urtica urens. All of the following are true regarding histological structure of a small intestine. Villi present in jejunum are longer than the rest of the small intestinal villi. Muscularis externa contain both circular longitudinal layers. Paired patches are prominent feature of ileum. Werner's glands are present in ileum. Galat. Werner's glands are not present in the ileum. And throbbing headache in the forehead just above the root of the nose is a symptom of throbbing headache in the forehead just above the root of nose. Symptom of arsenic album. Chronic coronary pulmonary means heart disease secondary to lung disease. Heart disease secondary to lung disease. And dehydration or shriveling of cadaver is known as mummification. Dehydration or shriveling of cadaver is known as mummification. Urine examination. Benedict test of 40 years old obese male showed a brick red precipitate. This is a result for accept acute post-streptococcal glomerulonephritis. The medicine that does not belong to composite family allows The medicine does not belong to compositive family. Yellow is not belong to Arnica, Cinna, and Calendula is a compositive family. A 28-year-old man presented with a discharging opening in the natal cleft overlying the coccyx on examination. Hair were seen projecting from the sinus. Most likely diagnosis is pilonidal sinus. The commonest cause of intracranial hemorrhage is hypertension. The most commonest cause of intracranial hemorrhage is hypertension. Pseudocyesis include the following feature: homesickness, morning sickness, distension of abdomen, and amenorrhea, except Hc level WB 72 hour. Pseudocyesis. Pathogenic mechanism in tuberculosis is due to cell-mediated hypersensitivity. While spinning to the left, the eye of dancer snap quickly to the left. This fast eye movement is known as nystagmus. While spinning to the left, the eye of dancer snap quickly to the left. This fast eye movement is known as nystagmus. Which of the following is not characteristic of sugar of milk? It is a double in soluble in alcohol. Severe bleeding occur when the platelet cell fall below 20,000 per cm. Which one of the following type of chronic disease was considered by Hahnemann as most deplorable and most incurable? Artificial chronic disease. Which of the following rotator cuff muscles of the shoulder is inserted into the lesser tubercle humerus? Subscapularis. Lacunar cell variant of Reed-Sternberg cell are found in which type of Hodgkin's lymphoma? Nodular sclerosis. The part of growing bone concerned primarily with the growth in the length is known as epiphyseal plate. Hepatopancreatic duct means opens into which part of duodenum is second. Swelling in bend of knee is a symptom of which drug? Magnesium carb. Bamboo spine is seen in ankylosing spondylitis. Which of the following is a characteristic radiological sign of intrauterine fetal death? Spalding sign. Which part of the plant of Cinchona officinalis is used for its preparation? Bark. Nessler's reagent is added to check the impurity of which substance in water? Ammonia. Dietary triglyceride that has just been absorbed is transported in the body in the following forms: cyclomicrons. Ischemic cerebral stroke is produced by all of the following except severe dehydration of acute onset. According to Hahnemann, which scale of potency is capable of producing medicine of highest development power and mildest action? 50 millismol scale of potency. Indicator of violence of disease is case fatality rate. Clumping of the finger is seen in lung sepsis. Nose stuff when there is cold rain is a symptom of Dulcamara. Forget me not is a common name of which one of the following drug? Myositis. Which of the following statement is not a feature of Fallot's tetralogy? Arterial septal defect. Which of the following statement is not a feature of Fallot's tetralogy? Tetralogy is a arterial septal defect.